So, for this module, we will be covering the role of the therapist in trauma informed care. Our hope is that by the end of this module, you'll be able to describe SAMHSA's principles of trauma informed care and also understand the role of the therapist in providing trauma informed care. When researching trauma informed care, we found it helpful to frame our lens around SAMHSA's principles of trauma informed care and thought that it would be helpful to share those with you all. So, the first principle is safety. This is in the context of creating an environment that values and recognizes physical as well as psychological safety for both those receiving care and those who are giving care. The second principle is trustworthiness and transparency. This is implied with decision making and communication within the care team, as well as with the goal of creating common trust and transparency for the therapeutic relationship. The next principle is peer support. This is a component that helps to build both a safe and trustworthy relationship and environment for individuals receiving care, and it helps for those who are receiving care to feel seen, heard, and valued. The fourth principle is collaboration and mutuality. This principle supports the concept that every team member is valuable and has something to contribute and should be treated with equality and respect. The fifth principle is empowerment, voice, and choice. This principle recognizes that the aim is to strengthen client, staff, and family experience of choice, and also recognize that each person's experience is incredibly unique and will require an individualized approach. And the last principle is cultural, historical, and gender issues. This principle recognizes that trauma informed care should aim to actively move past cultural stereotypes and biases, as well as offer culturally responsive services and increase the understanding of healing through one's cultural values. This principle also addresses the required recognition of trauma history related to people in a position of power acting in bias of individuals based off of culture, race, social status, or other groupings. So, as therapists, we have many skills within our unique background that help prepare us to deliver trauma informed care. Although some of our specific skills are varying based off of whether you're PT or OT or speech or anything along those lines, our common knowledge foundation around child development, therapeutic use of self, and strength based delivery of services will help support the implementation of any other skills that we might be bringing to the table. Because we have seen how trauma can manifest in all aspects of a child, from the way they think, act, and play, to the way that they communicate, move, and function, we truly need all hands on deck to give the most well rounded care to address the child's needs as a whole. It becomes about gearing those individualized tools that we already have to fit the lens of a child who is affected by their past traumas. It's important to note that trauma-informed care is a lens in which we approach treatment, not a specific method of treatment. So there's no single assessment or method that is able to address the complexity of trauma. Because of this, trauma-informed care is a way in which we deliver services given the knowledge that we have about trauma, its manifestations on health and function, and also the details about the specific child that we might be working with. This acknowledges the massive variety of impacts and responses of trauma, how it presents, knowing the triggers in each child's unique circumstance and needs. And above all, it is creating an emotionally, physically, and psychologically safe environment for all children and staff.
Some facilitators for implementing trauma-informed care in practice is having strong advocacy with the care team and school district for accessibility and frequency of care. Having clear and attainable progress expectation, having enough time, resources, and funding to address each children's individual needs, and also having a caregiver who is invested in continuing to support the children's needs and skill development at home. Knowing this, our role as therapists are to assess and observe the strengths and baseline and progress functions and needs of our kids. We are able to analyze these observations and how they might impact important component of the child's life, such as play, ADLs, and relationships. We can then use this information to collaborate with other professionals on the care team to give the child the most well-rounded interventions. From here, we can educate the child and then their caregiver to continue support at home. We can also use our therapeutic relation to be a person who is trustworthy and reliable for that child, as well as be a source of the joy and support where the child may not have that outside of the school. Among this, we can continue to advocate for the child and their needs within the school and home setting, and we can continue to educate ourselves as therapists on the best practice and trauma-informed care. In this module, we just covered the roles of therapists in implementing trauma-informed care. In the module 4, we'll discuss tiered approach to intervention in schools. Does include providing universal, targeted, and intensive levels of trauma-informed care. We'll provide examples of strategies you can use at each tier and with tier, and then we'll provide an overview of a study that successfully implemented a tiered approach to trauma-informed care in schools.